Hello everyone. Today I am going to tell you the curative therapy for the thalassemia major. So, in curative therapy, bone marrow transplantation or stem cell transplantation or gene replacement therapy can be done to cure the disease. So, what are the sources of stem cell transplant? They can take the bone marrow, or they can take the cord blood sample, or they can take the peripheral blood sample also. So, what are the steps of BMT? First, to destroy and prevent the regeneration of defective stem cells in the patients. Then, sufficient immune suppression for the good engraftment of the normal marrow. And then to infuse the stem cells with the normal gene for the beta globin chain. And further, to prevent the graft versus host disease with the high dose of immunosuppressant busulfan, cyclophosphamide, total body irradiation or other modalities should be done. Outcome of bone marrow transplant depend on all these factors. So these are the prognostic factor. On the basis of these, after BMT, survival rate and event-free survival depends. So presence of hepatomegaly, portal fibrosis and the irregular chelation all affect the prognosis. So according to these factors, patients are classified into three classes. So class 1, when none of the above factor is present, then success rate of BMT is around 93 to 95%. If patient is having one or two factors out of hepatomegaly, portal fibrosis and irregular chelation, then success rate around 85%. And class 3, when all three prognostic factors are there, patient is not on regular chelation therapy, patient is also having portal fibrosis and hepatomegaly, then success rate hardly 60%. BMT is most successful in patients who are young, properly transfused, well chelated and clinically well preserved without hepatomegaly. So these are the factors which affect the outcome of BMT. Before BMT, HLA matching should be done. But if they are taking the umbilical cord stem cells from the cord of unaffected fetus, then they can use the partially matched cord stem cell also for the BMT. Gene therapy or gene replacement therapy is another curative therapy for the thalassemia major. It is a hope for solution in the coming years. So in gene therapy, defective DNA in the bone marrow cell is supplemented with a copy of normal DNA. They can do it ex vivo outside the patient body also or in vivo inside the patient body. If they are doing ex vivo, then repaired cell return to the patient body. In genome editing technique, they target the specific mutation site and replace it with normal sequence. Limitation of this is to produce a large number of corrected genes which are sufficient to cure the disease. So thank you so much. It is all about the curative therapy for thalassemia major.